Hello and welcome to the Headache Doctor podcast. We're on this podcast. It's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to talk about a very, very prevalent problem and how to address it and understand it. Probably more on the evaluation and understanding part. What we're going to talk about is how to tell if you have a neck problem. You see, if you're new to this podcast, or maybe you're still trying to figure out what it is that we do or talk about as far as a foundational principle of understanding headache and migraine symptoms, we're neck specialists here at Novera Headache Center. That is where the head and facial pain that you experience is very likely coming from neck, jaw, shoulders. So one of the questions that we want to ask ourselves as we are trying to evaluate our own scenario, we're navigating this healthcare system. We don't really have answers. We're feeling frustrated and hopeless because we're just giving medication after medication. But we need to understand if we have a neck problem. There's probably about 30 to 40% of people that come through our doors here at Novera that we interact with from out of state that don't actually realize that they have a neck issue, which is really interesting because they very clearly do have a neck problem. And so how can someone have lost nearly all the mobility in certain segments of their neck, the segments of the neck that should be doing most of the work and most of the motion? How can someone lose all that mobility and not actually realize that they have a neck issue? Well, one of the things on a very high level, a practical level, that we're going to do on this podcast today is talk about the little things throughout your day that you might notice that would indicate you have a neck issue. All right? These are things that we want to identify and define the difference between what is common, meaning that a lot of people will experience this. And oftentimes when we use that word common, or when we see or experience things that are common, we would put them in the normal category. All right. Now, just because a lot of people might have neck issues doesn't mean that it's normal. And so some of the things that I will pull out as far as things that indicate you have a neck issue, they may seem like, well, everyone has that. We don't want to use that reasoning. We don't want to use the reasoning, well, everyone has that, as sort of a dismissal of the symptoms or a dismissal of this being a neck issue, because there are a lot of people with neck issues, and there are a lot of people with headaches, and there are a lot of people with migraines. It's very, very prevalent. The stats are kind of all over the place, but I anecdotally, when I tell someone what I do, without a doubt, they either have headaches or migraines or they're 1 degree removed from someone. And you can run this experiment with your friends and family, with people in your social circle. Just either mention that you have headaches or migraines, or, hey, I listen to this podcast. Do you know of anyone who could benefit from the podcast? I can almost guarantee that they'll say, oh, yeah, like either they suffer or someone they know that's like in their family, like 1 degree removed, like someone they know that they're close to is probably suffering with it, which means they have a neck issue, okay? Like 95% of the time, 99% of the time, if they're dealing with ongoing chronic head pain that comes and goes, we want to look at the neck, all right? So we're going to break down what it looks like to evaluate in yourself if you have a neck issue. And this is for people that, it's probably going to be most helpful for people that have this head pain but haven't really thought about their neck as much. But even those people that, if you're listening to this and you've realized you have a neck issue, you're probably going to hear some things and go, oh, yeah, that is me and I do that. All right, so we've got 2 categories. We've got the obvious things, the things that you are probably aware of as being neck problems. These are not things that most people would put in the category of being common and normal. Maybe they'd say it's common, but not necessarily normal. But maybe not. So the first one is your neck is stiff, right? So if you turn your head and your rotation feels limited, that would be a stiff neck. Oftentimes when people come to our office, they realize their neck is stiff to some degree. They may not see that as a problem, but they'll say, yeah, I have a hard time turning my head. Now, we have people all over the spectrum. We have people that their head can turn as far as anyone out there. Like their mobility is great, their general mobility. They probably have hypermobility in the mid portion of their neck, so they're able to they're like owls. They turn their head all the way. The upper part of the neck is still restricted, and so that's the area that we focus on. Then we have other people that really are so stiff they can hardly turn their head. They sit down, and if you're angled at all to the left or to the right by 5 degrees, 10 degrees, and they have to turn their head, it's probably going to trigger a headache or a migraine. Okay, so we have the very, very stiff necks and the very, very mobile necks. But the problem oftentimes is up high. And so it's how well someone compensates. But if you know your neck is stiff, it's going to be pretty obvious you have a neck issue. You have a mobility issue in your neck. If you have neck pain, all right? Now, we talk a lot about the upper part of the spine, so C1 and C2. The head sitting on C1 should nod. C1 and C2 should rotate. That's where a lot of our focus is. Neck pain oftentimes is going to be mid to lower part of the neck. So you kind of grab the bulk of your neck, the mid portion of the neck, or down kind of as you angle into your shoulders. So oftentimes that's what people refer to, that area, when they say they have neck pain. Now, neck pain, obviously, you're going to think you have a neck issue. That one is not hard. The thing about neck pain is that it's generally looked at, from our perspective, the same as what needs to change and what needs to be treated would be the same basic principles would apply to that situation with neck pain as it would to someone with a headache or a migraine. So the upper part of the neck not moving would add stress to the mid portion of the neck, causing the mid portion to have stress. This, for long periods of time, can cause the degenerative disc disease, herniated disc, stenosis in the mid portion of the neck. We almost always see that in the C3, 4, 4, 5, 5, 6, in those mid segments. Okay, so it has to pick up the slack. It has to do more work. The upper part's not doing its job, causing neck pain. Okay, if you have a forward head position, this might be another obvious one. Just about everyone that we interact with knows that a forward head position isn't the best, okay? And we know that 15 degrees of a forward head position will double the perceived weight on the neck. So your head's forward just a little bit. Maybe you're at the computer, you're at the desk, you're on your phone, even just in conversation. Whatever it is, the position you're holding, if your head is forward by 15 degrees, just double the perceived weight on your neck. So 10 to 12 pound head, maybe it's more like 20 to 25 pounds that your neck feels like it has to carry. Okay. Over time, that can add stress to the neck, leading to neck pain, neck problems. But in the short term, oftentimes your posture is in that forward head position. Your head's in that forward position because your neck is stiff. So it's kind of, the posture is assumed because of the stiffness and the tension. And there's other reasons for it. I mean, even tongue ties can cause your head to go forward just because you don't really have much slack in the system. And so your head is in that forward position. And so it may be a response to the tension you're already carrying, and therefore sort of a symptom of you having a neck mobility issue. There's less mobility than there should be. Of course, if you have a history of neck trauma, this would be obvious. You probably have ongoing symptoms, maybe that neck stiffness, maybe neck pain, maybe you have numbness and tingling in your hands, fingers, shooting down your arms. That is another one on here that is probably in the not so obvious category, but any sort of what we'd call radicular symptoms. So pain, numbness, tingling that goes and shoots kind of down your arms. Oftentimes people have ongoing numbness or tingling that they're dealing with, and that's something we see every now and then here at Novera. All right, your head feels heavy. This is potentially an obvious one as well. This speaks to typically, it's not exclusive to the person that has hypermobility, but oftentimes it does fall into that category because there's a sense of instability. Your neck doesn't really know how to support the weight of the head. And so the neck feels tired by the end of the day. It's just kind of ugh. I don't want to keep holding this head up. And oftentimes when people experience that, they will say, yeah, I know I have a neck issue. Okay. And then your headache presentation, it's an interesting one. And actually, Dr. Gutwein was just mentioning at our lunch meeting that it's fascinating how someone will have like a presentation of head pain that wraps back into their neck, or their neck that wraps up into their head. But our healthcare system has done such a good job of convincing people that headaches are not a neck issue, that even that presentation of pain, like we don't always assume there's a neck issue. And I would say it's actually more rare in our healthcare system to assume someone has a neck issue. And so oftentimes patients are like convinced to some extent that they don't have a neck issue because it's just never brought up. You do an x-ray, the x-ray looks fine, and you have pain in your head, even though you do have neck pain, but it's pain in your head. And Dr. Gutwein was saying it would be as if someone has like a knee problem and knee pain, and we'd say, well, it's probably your head. The pain is probably in your head, even though you feel it in your knee. Like if you feel pain in your neck and that pain travels, like we need to make sure you don't have a neck problem. Like even saying that to this mic and this camera, it just feels like, wow, that is just so simple. But our healthcare system, like it just doesn't, we don't get it. Like we don't get that. And I think it's largely because we're not evaluating the right thing. We're not seeing a neck problem. So we've worked so hard to explain it in different ways. And those different ways just lead to medication. And so no one's really getting better, is the bottom line. Okay. So those are the obvious ways. If the pain starts in your neck, if you have pain in your neck, even if it starts in your head and goes back to your neck, that would qualify you as like, you should think I have a neck problem. All right. So let's talk about the not so obvious ways. And again, let me just go back. The reason we're talking about this and you understanding if you have a neck problem is because it's super important to understand that treating the neck is going to very likely be your solution out of this. So you going through this list and saying, yeah, I can relate to that and that and that is going to be helpful for you, because then you will have confidence and feel empowered to say, yes, I need to pursue treating my neck because my neck is the problem and I'm convinced of that. Okay? So education is power. That's what we do on this podcast. We educate you so that you can feel empowered, where otherwise you would have no idea and just continue wandering through our healthcare system, trying to figure out what to do next. And that can be a pretty bleak process. So hopefully you're finding this podcast and it's like, hey, this is actually something that makes sense. So the not so obvious category would, so the first one, I guess it's sort of a segue into the opposite pattern. Like if the pain starts in your neck and wraps up and around, if you have a dominant head pain presentation, so pain in the temples, pain behind the eye, like that ice pick presentation, maybe it's above the eye or right behind the eye or pressure behind the eye. And then you also have a neck pain. Oftentimes the head pain is worse. And basically what happens is when a part of the body has irritation in it, like if it's sending a pain signal, the worse the pain signal is, the more intense the pain signal is, the further that pain signal will travel. Okay. And the distance that it's traveling is kind of like, oftentimes on the periphery of it is where the pain is the worst. That's not always true, but generally that can be true, especially when it comes to the neck. So if your neck hurts, you can have really intense eye pain that has nothing to do with your eye. Okay. And so that's a referral pattern. But that can be trickier for people because it's like, man, my eye really, really hurts. But, oh, yeah, my neck also hurts. It's not as bad, but my eye is really like debilitating pain. You'd assume to some extent that, okay, we got to make sure your eye doesn't have a problem. Our healthcare system's good at checking eyes, and generally, like almost 0% of the time, like people have actual eye problems, meaning like ophthalmologist looking at your eye and looking for something that causes debilitating pain. Now, a lot of people may have like movement problems with their eyes, like convergence, and need to go see a vision therapist and things like that. But as far as looking for like, okay, it feels like something's stabbing in my eye, I mean, the obvious thing to do would be like, well, let's see if something's stabbing your eye. Like, that's what I'm talking about. Like, that's never the case. And you would know if something was actually stabbing your eye. But that's what it feels like for people. They feel like there's a hot poker, that sort of stuff. And it's just your brain perceiving this happening. But it's all a referral pattern. So that can be confusing. That can be a not so obvious neck issue. If you have SCM tension, so the SCM is the sternocleidomastoid. It's this muscle that it kind of like runs along the side of the neck and then wraps around the front. If you look at people's necks in not a weird way, but if you observe people's necks, you will see it's actually fairly common that some people will have a very prominent SCM. If you're watching on YouTube, I'm kind of grabbing it here. So if you grab that sort of fleshy, meaty muscle on the side of your neck and you squeeze it, I bet you that you'll get like some sort of pain locally, but it may, if you get the right spot, it may like travel up to your ear or to your jaw. Okay. And so the SCM is generally it'll be more active when the neck isn't as stable, when the neck is under more stress than it should be, if you have a forward head position. So the SCM being more active and having those like sensitive spots in it indicates that your neck is not really functioning super well. Okay. Now, this is something that I see. I could probably just look at someone and how they stand, their posture, the definition of their neck and their head and their jaw, how their head sits on their neck. I can look at all these things and evaluate it and say, yeah, you probably have a neck problem and maybe you are experiencing migraines. And I feel like I actually haven't tested this. I don't know how I would test this. Like if it, lined 100 people up. I feel like you can see this stuff. And when you start to see it, you're like, oh, actually a lot of people have these neck issues. Okay, so another thing and not so obvious is you just don't move much. Now, you might not think you have a neck issue, but if you sit at a desk job or whatever it is throughout the day that you're just sedentary and you're not moving, you have a very high chance of your neck not loving that and over time stiffening up, tightening up, and you might not actually feel much outside of maybe like a dull headache or a tension headache that builds up in the afternoon. But just the fact that you're sitting most of the day, I would assume that your neck doesn't like it. Okay, so your body wants to move, your neck wants to move, and if you don't give it the movement it wants, you're sort of creating a problem. We have this idea in our heads, like it's kind of intuitive. Like it sounds nice to say, I'm just going to relax, and relaxing has sort of this underlying tone of this is good for me. Like I need to let my body just calm down. But oftentimes we don't actually like exert ourselves enough for that to make sense. Like we haven't given our bodies the movement and really just exert ourselves in a way where the relaxing is actually therapeutic. Normally it's just we're sort of like unwinding our brain or our physical, like our emotional stress from the day, and we just want to like shut our brain off and do something. Like we just sit on the couch. And again, we go from like maybe kind of moving to not moving or not moving to not moving. And that lack of movement is really hard on our neck. I tell people it's like holding the bowling ball, and it's just you hold it in one spot and kind of in front of you. Like you're going to fatigue really quick as opposed to like moving it from spot to spot and keeping it close to your body, which is what we want to do with our head and give our neck a break. Let's say you wake up with a kink in your neck. You may think like, man, this is just like common and normal and everyone wakes up with kinks in their neck. Well, no, not really. I mean, you kind of have to start with a stiff neck that you're dealing with and compensating, and you're okay most of the time. But then you sleep funny and you wake up and you're like, man, I can't turn my neck. Generally, that means you have or had a neck issue, like an underlying neck problem, and it's just like surfacing. That generally calms down after a couple of days. But if you match it with other symptoms, like you also have headaches and ear ringing, ear fullness, jaw issues, all that stuff, it can start to make sense. Like, oh yeah, this is probably a neck issue. On that same note, jaw popping, clicking pain. So I have yet to see someone that has jaw popping, clicking pain in their jaw, TMD, temporal mandibular dysfunction. Oftentimes people say TMJ. I have yet to see someone like that doesn't have a neck issue. So they go hand in hand. Your neck tension is going to impact the way the jaw functions. And so if you're like, yeah, I feel like my neck is fine, but my jaw pops all the time and clicks and I have pain in my jaw, like I think it's safe to assume you have a neck issue. And so don't think just because your neck doesn't hurt, but only your jaw does, that it's just your jaw. Our body doesn't necessarily like function just in isolation. That is not something that we see. Okay. So ear fullness, ear ringing. There are potentially other causes to ear fullness, ear ringing. But a lot of times if you're dealing with a headache and your jaw pops and clicks and then you have ear ringing and ear fullness, oftentimes it'll match that same side. So it's like my headache's on my right and my right ear rings. Not always, but we want to connect these dots, and ear fullness, ear ringing is something that indicates your neck is tight and it's impacting eustachian tube function, which regulates pressure. There's just the tension built up being close in proximity to the ear can cause just that slight change in sound, that little tone that you hear, that sort of thing. If you have a head tilt, this one's kind of interesting. So going back to just observing people and seeing, if I can evaluate if they have a neck issue or not, if their head's tilted. So it's pretty subtle. I think most people would probably have a slight head tilt. Some people, it's pretty obvious though. Like they just stand and they're talking to you and their head's like tilted the whole time. If you notice that and someone's like obviously tilting their head, I don't know a scenario where socially this would like make sense, but if it's like a close friend or something, be like, hey, do you have headaches? Like, does your neck hurt? Do you have ear fullness? Does your jaw pop or click? Like, and it would be interesting to see if they're like, yeah, actually, like all that stuff comes and goes, and I don't know how to connect it. Is it all connected? And then you can be like a headache wizard, and then tell them about this podcast. All right, so head tilt, and then shoulder tension. Again, maybe less obvious because people would separate shoulder tension from neck. But if you have shoulder tension, like if you feel like you wear your shoulders like earrings and they're always shrugged up, the shoulders are connected in the neck. The reason they're pulling up and the thing they're pulling on is the neck. And so the neck would have an issue with that. There's more stress on the neck. So very likely that your neck is also dealing with tension and you have a neck problem as well as shoulder stability, shoulder tension issue. One final thing, a lot of people, this may go in the category of just like feeling like your neck is stiff, but a lot of people have a hard time checking their blind spots and they just think like, oh, I'm just, I don't know, like getting old or something. That's not a normal thing. We should be able to turn our heads, might get maybe like a little bit of stiffness as we age. But for the most part, if you're in your 30s or 40s and you're like, I can't really turn my head to check my blind spot, your neck is very stiff and you should be able to turn your head to check your blind spot. And again, maybe one of those things that's not quite so obvious or people would like dismiss it. They maybe say, yeah, I guess my neck is stiff, but I didn't see it as a neck problem. All these things I would put in the category of like, if you're experiencing them, it means that you've likely lost nearly all of the mobility through C1, C2, and the head sitting on the first bone. So we get rotation, we get nodding up high there. It's adding stress to the mid portion of the neck. It's sending pain up into the head. And that area is the area that we want to focus on, restore mobility, so that we can really get you back to functioning as efficiently as you should be able to, and your neck being able to hold your head up, your neck being able to move like it should, and ultimately not having headaches or migraines, and getting off of all those meds. So there you have it. This podcast, I think, hopefully is empowering you guys and giving you talking points when you interact with friends or family members of, hey, I heard this guy talk about head tilts and how head tilts shouldn't be a normal thing. It usually means that your neck is stiff. And do these other things sound like you? Or someone has headaches and you're like, well, do you notice that your neck is stiff? Do you also have jaw symptoms? Do you have ringing in your ears? Do you have a forward head position? Do you sit most of the day? So you can sort of like start to put the puzzle pieces together and you'll kind of go down the same journey that I've gone on the last like 8 to 10 years of just realizing that these neck problems are very prevalent and common. And there's a lot of people out here that we can help. So there you have it for today's podcast. Thank you all so much for listening. Please share, like, write a review, 5-star review that will help continue to get this information out there for people that are struggling and are feeling that they're hopeless and that they don't know where to turn. And so we want to get them better. We want to get you better. We want to get them better. There's a lot of people out there with headaches or migraines, so help us on that journey. Thank you all for listening as we continue to educate and empower everyone with headaches and migraines so that we can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.